Commissioners, and I just want to take this opportunity to welcome everybody to our ARP, American Rescue Plan, informational, I guess it's an informational hearing session to make sure that you understand that the funds that we are receiving is going to be put to the best use for our community. And I want to make sure that I let our staff know how much I appreciate all their efforts and all they have done over the days and months and trying to figure out what is allowable and what's not allowable. So my staff is great. I appreciate all the hard work that they have put in. And without further ado, I will turn it back over to Mr. Stanford, who is our Chief Operating Officer, and he will go from there, I believe. So everybody have a great day, be blessed, and be safe.
First of all, we'd like to thank our chairman for giving us kind of an overview, or a brief overview, and I'll expand and expound upon that in a second. But we want to make sure we do this kind of in order. So we have a moderator today. Well, I'm going to turn it back over to Ms. Mia to kind of give us perspective about today, and then we'll go through the program as outlined.
Thank you, Chief Stanford. In today's discussion, we will share information about available funding through the ARPA, get community input, and briefly take public comments. A brief background about the American Rescue Plan Act. In May 2021, Clayton County announced they will receive $66 million in COVID relief funding through the recently passed American Rescue Plan Act, ARPA, of 2021. This one-time money will be used to improve the quality of life for Clayton County residents and create a long-term investment in the county's future. Now we are seeking feedback from residents, businesses, and community organizations about their priority use for these funds. With that, we will get started by having the panelists introduce themselves. Dr. Smith.
Good afternoon. My name is Dr. Shalonda Smith. I am the Chief Strategy Officer for the Office of Performance Management.
Mr. Nelson.
Hi, I'm Dennis Johnson. I'm the Deputy CFO for Clayton County.
Thank you, panelists. We will now get started with the presentation.
So to get started, kind of piggyback off of what Ms. McDonald said, Clayton County was allocated $66 million. On June 4th, we received $33 million. Keep in mind that this is a one-time federal stimulus. It's paid in 2 installments. We'll probably receive the next installment within the next year or so. Funds may cover costs from March 3rd, 2021 to December 31st, 2024. Funds must be obligated by December 31st, and also funds must be expended with all work performed and completed by December 31st, 2026. Just to give you a background a little bit, the funding objectives basically for this is to support COVID response efforts, to replace lost revenue by eligible states and local governments, support immediate economic stabilization for households and businesses, as well as public health and economic challenges that were contributed to the unequal impact of the pandemic on certain populations. I like to I laugh because this is our Bible. This is the Treasury's interim rule. The final rule will be posted and presented to all counties and local and state governments by Friday. We follow this guideline. This gives us guidance on how we can and spend the money. But again, we are welcoming county residents' input. We also have participated in webinars offered by Department of Treasury, NACO, the National League of Counties, National League of Cities, I do apologize, and the ACCG for guidance and technical assistance.
Okay, as a reminder, Dr. Smith and Deputy Chief Financial Officer Nelson will go through the presentation. We will have community input through polling, and viewers and attendees will have a chance to give feedback through public comment. Dr. Smith?
So to move forward, what you see on the slide is what we call the Department of Treasury what they have as allowable use and guidance on what we can spend funding on in these 6 categories. Of course, the first one is the public health response. It refers to any medical, behavioral health care, and certain public health and safety for staff. Then we have the replacement of public sector revenue loss. Anything provide government services to extend reduction in revenue that was due to the pandemic. We also have what we call water and sewer infrastructure, so necessarily investments to improve the access of clean drinking water. We also have the negative impact, economic impact. It responds to the economic hardships to families, workers, and small businesses, as well as premium pay for essential workers, and then the broadband infrastructure, necessary investments to provide underserved or non-served locations to expand access to broadband. So what you see on the slide is the chairman's priority for Clayton County. The first one, again, is the public health response, and this is priority level. So his first priority is the public health response. His second one is the negative impact. The third one is replacement of lost revenue. The fourth is broadband infrastructure. The fifth is premium pay for essential workers. And the sixth is water, sewer, and infrastructure. So the next slide is, keep in mind that all 6 of the allowable categories somehow directly or indirectly affect Clayton County community, but we wanted to point out the 3 that actually directly affect you. And those are the public health response, the negative economic impact, and the premium pay for essential workers. So when we're looking at this, we are looking at a formula to prioritize recommendations to the BOC. And what you see at the bottom of the slide is the interim rule, which I call, and I'll lift it again, my Bible, and then we'll take out projects that are not eligible based off the 6 categories. Then we will take chairman's priorities and then make recommendations to the board what projects fit that category. So when it comes to public health response, it's services and programs that are in need to contain the COVID-19. That's vaccination programs, it's COVID testing, and it's even some paid and sick family leave that's related to COVID. Medical expenses, it's providing care and services that address COVID, enforcing the public health orders, and supporting isolation and any type of quarantine as it relates to COVID. Then we have what we call the behavioral health care. Those are services that are needed to meet the mental health, substance abuse, and any other behavioral health services or needs. And of course, the public health response is public health and negative impacts of COVID that requires additional human resources to make sure that the community is safe. As it relates to addressing negative economic impacts, assistance to household is assistance to household for unemployed workers that are impacted due to COVID. It provides job training, food, housing, cash, and other type of assistance to the household. As it relates to small businesses, we're looking at loans and grants to mitigate financial hardship, technical assistance, helping businesses as it relates to creating and developing business plans and any type of counseling that we could provide them. As it relates to the public sector, replenishing state unemployment insurance funds. Impacted industries, tourism and travel, hospitality as well, in terms of how we support those industries as it relates to COVID-19. So the definition, as Department of Treasury looks at premium pay for essential workers, the fiscal recovery form payments may be used by recipients to provide a premium pay to eligible workers performing essential work during the COVID-19 public health emergency, or to provide grants to third-party employers with eligible workers performing essential work. So eligible employers, essential employees, are defined as workers needed to maintain continuity of operations in any critical infrastructure. That's staff that house nursing homes, hospitals, and home care settings, truck drivers, transit staff, warehouse workers, public health safety staff, child care workers, educators, and other school staff, as well as social service and human service staffs. Essential work is defined as work involving in-person interactions on a regular physically handling of items that were also handled by others. What is not an essential worker? Anyone that teleworked from a resident. Other provisions that's related to the premium pay, county should prioritize premium pay for individuals who have low to moderate income levels. As we're doing this, Department of Treasury is looking at ensuring that we have reporting requirements. This is just an overview of some of the reporting requirements that we have to submit to Department of Treasury in regards to how we're doing funds. The first interim report is due August 31st of this year, and it's really just a category of summarizing how we're going to spend the money that we received June 4th through July 31st. But the key part of this reporting part for the community is the recovery plan performance reports. Those are, the first one is due August 31st, and those have to be submitted and put online. So we will have the website that you see below is a website where you can actually, as a constituent, review the performance reports in terms of what we're doing.
We will now have our first polling question. Is the COVID-19 crisis negatively affecting your family financially? Thank you. On the screen now you will see the results. And with that, we'll turn the presentation back over to, and excuse me, I misspoke earlier, Deputy Chief Financial Officer Dennis Johnson and Dr. Shalonda Smith.
All right. I'm going to provide you with a review of the projects that were submitted by the various entities throughout the county. Prior to the receipt of the funds, the county pulled together all the various participants during the crisis from all aspects, from hospital, water authority, all the relevant department heads and entities that serve Clayton County, and they all made requests of these funds. And I'm going to quickly go through these requests for you to be able to see them. The first requester was the Clayton County Water Authority, and they requested projects such as debt relief for some of their customers and themselves, hardship assistance to improve the support to different individuals at the who may have a hard time paying their bill at this time, and several other projects, as you can see, were capital projects that were provided, for infrastructure and to enhance the water capabilities of the county. And that total was $29 million. The next request was from the Clayton County Tourism Authority, and as we're all aware, the tourism business in Clayton County was impacted fairly hard. There's two requests that were made from them. The first for some billboards promoting the county as a tourism site, and the second were 3 digital displays to do the same. And that total request was $200,000. Another request was made on behalf of the county was to expand the medical examiner contract and to provide detailed medical examiner services for the county. And that was $4.3 million. Our police department made 2 requests. The first request was for a police social worker to interact with different members of the community as they interact with different scenarios and increased mental health challenges. The second was a $500,000 request for 250 AED units to provide safety for any participants who may have need a defibrillator in service. And that total request were $588,000. The next request was from the Community Service Board, and that amount was $20,733,394,000. And there were several different requests for a behavioral health crisis center, substance abuse crisis, premium pay for essential workers, and also electronic health record system, broadband enhancement, and hardship assistance, and also COVID costs. And that total request was $20.7 million. The next request was from Southern Regional, and there were 4 different phases of the request that were made. And the first one was for $4,395,000, and that was to enhancements for staffing and bonuses to enhance newer members to come on board. The next 2 or 3 were for updates to the hospital themselves and to provide the kind of units that may be necessary should the pandemic continue. And that total request was $17.795 million. The next request was for information technology, and that came from environmental replacement of critical servers, our ability to work remotely much more enhanced, and also in many cases cybersecurity enhancements that are necessary for all the additional work that is done online and through the system. And that total is $2.5 million. The next request was from court administration, and these were for $34,000. And this request was strictly for the physical barriers and items that were going to be necessary for the courts. In addition to this, we anticipate receiving requests for what we would consider judicial equity, where we're trying to speed up the process through all the courts that have been shut down for the better part, and to guarantee speedier trials and movement through the court system. And that would affect both all the courts, the 4 courts, and also the DA, the solicitor, and public defender's office. The next request was from Fire, EMS, and EMA, and that was to provide for the public health aspect of $850 to have another mobile laboratory that was so widely used during the pandemic for testing, and also some water and infrastructure a request for certain areas to make the county safer in the amount of $100,000. And that total request was $950,000. Human Resources made a request for premium pay options, and there were 2 options, and that request totaled $25,900,000 for the enhanced pay to critical public safety workers. Our Senior Services requested support to the Alzheimer's Service Center for both deferred maintenance and additional operating costs to help that unit stay together, and that total was for $746,000. Community Development requested $600,000 for down payment assistance, $750,000 for emergency home repair, and then they also wanted to set up a community housing development organization in the amount of $4.5 million. And those requests totaled $5.8 million. The Clayton County Housing Authority also had some new construction and rehab requests in the amount of $5.6 million, and then some additional investments in housing and neighborhoods in the amount of $6.5 million, and that total request was $12.2 million. The Chamber of Commerce requested $150,000, $75,000 for small businesses, $50,000 for educational disparities, and $25,000 for health disparities. Economic Development requested $5 million for small business grants. They requested $5 million for housing development partnership. They requested $200,000 for a business attraction campaign, $250,000 for county marketing. They requested $1.5 million for a nonprofit hub, a location to provide the nonprofits, and then also $50,000 for a business rescue packet to provide for the various businesses in Clayton County. And the total amount of that request was $12 million. We had a request from the Clayton County Development Authority, and for that they were requesting $1.175 for job training, quick training to provide individuals with jobs and new opportunities based on industries that are taking off. And they also looked for a $1 million small business grant program similar to the one we did under the CARES. And that total request was $2.1 million. As you can see, we have a timeline, and we expect to get approval for the recommendations at the June 20th business meeting of the Clayton County. And so we'll be tabulating the requests that we get. We'll be gathering additional information for these projects that were submitted, making sure that we're able to continue to vet whether these projects are allowable or not. And then we will announce that on the meeting, the meeting on the 20th, and then we will make funding distributions beginning in August. Just in summary, you're going to be able to see that the request totaled $135 million, and the total award that we received was only $66.8 million. So there's many projects that are going to have to be consolidated, combined, put together so that we are more effective in what we're providing to the community. As you can see, we have additional questions can be sent to the link above. And also, if you'll see the second link that's shown on the screen, it's important that we hear from you. And we would like every citizen possible to provide a survey so that we can get a complete look at what the needs are within the county, and we can do everything we can do to meet those needs.
Thank you, Deputy Chief Financial Officer Johnson. We will now continue with polling questions, and please be mindful that we are allowing 45 seconds for each question. Is the COVID-19 crisis negatively affecting your children's education? Okay, thank you. These are the results. The next question is the COVID-19 crisis negatively affecting your physical, mental, or emotional health and well-being? Again, we're going to allow 45 seconds for each question. Okay, here are the results. Our fourth question is, how important is it that resources be focused on immediate needs for workers, families, and small businesses? Example, food security, financial counseling, job training, home buyer, and property repair grants. Here are the results. And our last poll question for today is, how important is it that resources be focused on longer-term investments to encourage job creation, economic development? For example, tourist attractions, large infrastructure projects. Okay, here are the results of the last question. Thank you to everyone who participated in the poll questioning. We will now allow 2 minutes for public comment. We actually have a participant in person who is coming up for a public comment.
It's a question online. It's a question online.
And we will address the question online.
Okay. Good afternoon.
Good afternoon.
I'm Charlton Bivens, a Clayton County resident in Jonesboro area, unincorporated Jonesboro area. I looked over the actual report earlier, last night, and my biggest concern or desire, if I may say, is that if we're talking about the medical improvements, or where am I going with this? If COVID is the issue, I'd like to say that a lot of non-governmental human services organizations have taken on a major role, along with governmental organizations here in Clayton County. That lump sum of money, or quite a bit of that money, I think it can be best served if some of those dollars went into a formal program whereby our nonprofits that are serving our community can benefit to a greater degree. And where I'm going with that is this. We had nonprofits that did food giveaways. We had nonprofits that paid bills, that did the mortgage rescue or the foreclosure rescue monies and those type of things. I'd like to see us have a more formal grip on our nonprofits in Clayton County, because I truly believe when people call the probate court or call some of the different entities in the county about their inabilities to do things, our county as a whole couldn't say, go see Hearts to Nourish Hope. Go see, we don't have that major, we do have the grassroots leadership program, but I'd love to see there be an even greater entity that the county was involved in, to the degree that when we have crises like this, and under the whole premise of it takes a village to raise a child and raise a family or raise this community, that we had a better grasp of that, and then this money would definitely help them either recover what they did all year long and make them a better organization coming up. So that's first comment. Second comment, this is the perfect time to create a situation in our parks being the second level of interaction with our youth. I would love for our parks to have the internet access throughout parks, have the technology access throughout every park, or everything that touches a child's life that's related to our parks. I'd like to see quite a bit of that money go toward our parks to the degree that they are able to provide the utmost premium service for our thing. I heard about this money can't go toward the school system, and I hope they got a part of money. Is that correct? They got a part of.
Yes.
Well, great. I won't even bring that up. But yeah, parks and technology, and then our nonprofit system. We should create a nonprofit system second to none. Since they've done such a wonderful job throughout this whole COVID crisis, from the standpoint of where they were. Imagine if there was a support system in place that really put them on that throne, on that level, so that next go round, it's just commonplace.
Duly noted, and we are working to make that happen, because you're not the only resident to state that. So we've been working with finance to see how we can create a pot of money for the nonprofit. So duly noted, sir.
And just as a reminder, using the CARE funds, that's exactly what we did. We created a pool of money strictly for nonprofits. They were able to submit their requests, and we were able to fund them directly, new members, and allocate those funds directly to them to enhance the work they're able to do in the community.
Great. All right, thank you.
Thank you all for tuning into the Clayton County American Rescue Plan Act Public Information and Comment session. If you submitted a question or if you have questions, the response will be posted on the relief.claytoncountyga.gov webpage in the next 48 hours. To take the CC American Rescue Plan Act funding survey, access www.surveymonkey.com/r/Clayton COVID Fund Survey. Thank you all and enjoy the rest of your day.